Hello everyone, today I am going to talk about a very important topic, that is treatment of pneumothorax. In previous class I discussed about investigations and complications of pneumothorax, and in this class I would be talking about treatment of pneumothorax. So see, there are three goals for treatment of pneumothorax. First is to promote the expansion of the lung. Basically pneumothorax क्या होता है, air or gas enters in the pleural cavity and it leads to collapse of the lung. There is lung deflation, so we need to re-expand the lung. So first goal is to promote expansion, to promote lung expansion. That is the first goal. Second is to eliminate the pathogenesis, so basically इससे क्या होगा, the disease will not progress, there will be no progression of pneumothorax if we stop the pathogenesis. And third is to decrease the recurrence, to decrease the repetition, to decrease the recurrence of pneumothorax. So basically that is the third goal. To treat pneumothorax there are a lot of options, बहुत सारे options होते हैं according to classification, according to pathogenesis, according to the severity of the disease, according to the extent of lung collapse. So basically बहुत सारे treatment options होते हैं according to these parameters. So according to classification, we know that there is primary spontaneous and there is secondary spontaneous pneumothorax. Primary spontaneous मतलब क्या होता है, there is no underlying lung disease. So in primary spontaneous pneumothorax, the mainstay of treatment is observation. Basically हम observe करते हैं patient को, और there is no hospital admission required. So basically observation is the mainstay of treatment, and patient is asked to return to the hospital only if he develops breathlessness, acute attack of breathlessness. So basically this is about primary spontaneous pneumothorax. It is also called PSP, primary spontaneous pneumothorax. So now I would be talking about how to treat secondary spontaneous pneumothorax, SSP. So basically इसका मतलब है there is an underlying lung disease, pneumothorax is caused because of an underlying lung disease like COPD, bronchial asthma, suppurative lung disease, cavitary active pulmonary TB. So basically I have discussed this in previous class. So this is secondary spontaneous pneumothorax. So see, if the secondary spontaneous pneumothorax is less than, the pleural tear which is formed is less than 1 centimeter, or there is a isolated apical pneumothoracis, isolated single apical apex of the lung pneumothorax, then to treat this we give supplemental high flow oxygen inhalation देते हैं through mask. So that is, the rate is 10 liters per minute. You should know this, the rate is 10 liters per minute. So basically ये क्यों देते हैं, to decrease the pressure of gases in the pleural capillaries, So इससे क्या हो जाता है, there is increase in the gradient of pressure between the pleural capillaries and the pleural cavity, and the air is sucked from the pleural cavity to the pleural capillary. So basically we give high flow oxygen 10 liters per minute to decrease the total pressure of gases in the pleural capillaries by decreasing the partial pressure of nitrogen. Oxygen देते हैं तो partial pressure of nitrogen decrease हो जाता है, उससे total pressure of gases in the pleural capillaries is reduced, and there is increase in the gradient of pressure between the pleural cavity and the pleural capillary. So क्या हो जाता है, air travels from pleural cavity to pleural capillary. So मैंने जो बोला था मैंने वही लिखा है. So there is increase in the pressure gradient between the pleural capillaries and the pleural cavity. So air is absorbed from the pleural cavity to the pleural capillary. So you should know this is a fact. The rate of reabsorption is 1.25 to 1.8% of volume of hemithorax per 24 hours. You should know this is fact. So now I would be talking about active intervention. So basically it involves simple aspiration and chest drain application. So active intervention, simple aspiration, aspirate करते हैं हम. It is the first line of treatment for primary spontaneous pneumothorax. So we aspirate the air or gas which is there in the pleural cavity. So basically it is first line of treatment for primary spontaneous pneumothorax, and and it is only recommended in secondary spontaneous pneumothorax if the pleural tear is less than 2 centimeter and the patient is minimally breathless. He is minimally breathless and the pleural tear is less than 2 centimeter, and if he is less than 50 years of age. So basically this is about simple aspiration. Now second is repeated and catheter aspiration. So catheter से हम aspirate करते हैं. So basically if this first simple aspiration fails, then only we do this catheter aspiration. We repeat this catheter aspiration, and the volume of the air is taken out is less than 2.5 liters. So now I would be talking about third part, that is intercostal tube and underwater sealed ड्रेनेज. सो बेसिकली हम जो एयर लीक हो रहा है उसको हम सक करते हैं. द एयर विच इज़ लीकिंग इज सक्ड एंड इट इज़ अप्लाइड आफ्टर 48 hours. इफ देर इज persistent leakage of air and the collapsed lung, the deflated lung is not able to re-expand, then we use intercostal tube and underwater seal drainage. So see, you should know this. High volume low pressure suction systems are recommended. High volume low pressure suction systems are recommended. Now I would be talking about chemical pleurodesis, that is the fourth part of active intervention. So basically pleurodesis का मतलब होता है we obliterate the pleural cavity by forming adhesions between the chest wall and the pleural cavity. So basically this is chemical pleurodesis. Now goals is to prevent the pneumothorax recurrence. To prevent the recurrence of pneumothorax, we do pleurodesis, and second is to produce inflammation of pleura and adhesions. Basically this is about goals of chemical pleurodesis. So now I would be talking about indications of pleurodesis. So basically when there is persistent air leak, then there is persistent leakage of air, then we do pleurodesis. Then second is bilateral pneumothoracis. जब दोनों साइड पे pneumothorax cause हो जाता है. So basically that is bilateral pneumothoracis. And in some occupations when pneumothorax should be prevented, where pneumothorax should not occur, like drivers, pilots. So basically we do pleurodesis. So these are the indications of pleurodesis. So we use sclerosing agents like tetracycline, minocycline, doxycycline, talc, erythromycin. So basically ये क्या करते हैं, these produce aseptic inflammation with dense adhesions. So basically sclerosing agents मतलब वो narrow कर लेते हैं जो pleural cavity उसको obliterate कर लेते हैं. So basically tetracycline, minocycline, doxycycline, talc, erythromycin, basically these are sclerosing agents, and these produce aseptic, means sterile aseptic inflammation with dense adhesions. And so now I would be talking about other types of pleurodesis. So these include biological pleurodesis. May we use an organism Corynebacterium parvum. So basically this is biological pleurodesis. Now other type is physical pleurodesis. So this is done by mechanical abrasions की मदद से हम लोग physical pleurodesis cause करते हैं. So basically this is about other types of pleurodesis, biological and physical. Basically you should know this, these are facts. Now I would be talking about surgical treatment. So in surgical treatment, indications for surgical treatment, when there is no response to medical treatment. So basically जब हम medical procedure से pleurodesis करते हैं, like we use sclerosing agents, when we do biological pleurodesis or physical pleurodesis, उससे results नहीं मिलते, then we use surgical treatment, we use surgical method of pleurodesis. And it is an indication, it is a main indication. Then if there is hydropneumothorax, means air plus fluid in the pleural cavity. So basically this is hydropneumothorax. It is a rare complication of pneumothorax. Then tension pneumothorax, it is also an indication. Tension pneumothorax which is failed to drain. So tension pneumothorax क्या होता है, there is mean pleural cavity pressure is greater than the atmospheric pressure and lung mediastinum is pushed to the opposite side. So basically this is tension pneumothorax. So it is an indication for surgical treatment. And when there are thickened pleura, मतलब pleura thick हो जाती है, और when lung cannot expand, if pleura is thickened then lung cannot re-expand. So basically it is an indication. And when there are multiple bleps means air-filled cavities less than 1 centimeter in diameter. So basically this is about surgical treatment, pleurodesis. So now I would be talking about the surgical procedures. So main is the open thoracotomy and pleurectomy. So it is the mainstay of surgical treatment. So इसमें thorax को incision करके open कर लेते हैं. So for better visualization and biopsy surgical procedure. So basically that is thoracotomy, and pleurectomy means we cut the pleura, we remove the pleura. So basically that is pleurectomy. And there are minimally invasive procedures. There are a lot of minimally invasive procedures like thoracoscopy, endoscope डालते thoracoscopy, pleural abrasion, surgical talc pleurodesis. So basically you should know this. These are minimally invasive procedures. This is fact. Thoracoscopy, pleural abrasions, and surgical talc pleurodesis. So basically this is about surgical treatment, pleurodesis. So now I would be briefing you about the treatment of pneumothorax. So first I would be talking about goals. So there are 3 goals. First is to promote the expansion of the lung. Second is to eliminate the pathogenesis of pneumothorax. And third is to prevent the recurrence of pneumothorax. So this is about goals. Then so now I would be talking about treatment options. The treatment options are based on classification, extent of the lung collapse, severity of this disease, then pathogenesis, pneumothorax frequency. So basically this is about treatment options. So I will be talking about PSP, that is primary spontaneous pneumothorax. So basically observation is the main step. So observe the patient, and you should not admit the patient in hospital. You should admit only when the patient presents with breathlessness. So basically this is primary spontaneous pneumothorax. There is no underlying lung disease. Now secondary spontaneous pneumothorax, there is an underlying lung disease, and observation and hospitalization is the main step. So basically क्या होता है, we give high supplemental hyperbaric oxygen 10 liters per minute. So उससे क्या होता है, there is increase in the pressure of the pleural capillaries. So there is increase in the pressure gradient. So air flows from pleural cavity to the pleural capillaries. So basically air is sucked from the pleural cavity, and this condition pneumothorax is treated. The rate of resorption resolution of spontaneous pneumothorax is 1.25 to 1.8% of volume of hemithorax per 24 hours. So you should know this. So now I would be talking about active intervention. Active intervention deals with aspiration and drainage of the air. So basically first is simple aspiration. Simple aspiration में हाँ aspirate करते हैं the air, and it is the first line treatment in primary spontaneous pneumothorax, and we do simple aspiration in secondary spontaneous pneumothorax when the pleural tear is less than 2 cm and it is the patient is minimally breathless and he is less than 50 years of age. So basically this is simple aspiration. Now repeated and catheter aspiration, this is done if simple aspiration is unsuccessful and less than 2.5 liters of air is sucked out, is aspirated. So basically that is repeated and catheter aspiration. This is second one. So third is the intercostal tube and underwater seal drainage. So basically इसमें हम suck करते हैं, we suck the air suction systems. It is done after 48 hours, and it is done if there is persistent leakage of the air. High volume, low pressure suction systems are used. So I would be talking about chemical pleurodesis. Chemical pleurodesis में क्या करते हैं, we obliterate the pleural cavity. We form adhesions between the chest wall and the pleural cavity. So basically that is chemical pleurodesis. So first I'll talk about goals. So there are 2 goals. First is to prevent the recurrence of pneumothorax, and second is to produce inflammation and form adhesions between chest wall and pleural cavity. So basically this is about goals. Now so indications of pleurodesis, it is indicated in recurrent pneumonia, it is indicated in recurrent pneumothorax, then it is indicated in bilateral pneumothoraces, and it is also indicated in to prevent pneumothorax in occupations like pilots and drivers. So basically this is about indications. Now we use sclerosing agents use करते हैं to produce aseptic inflammation and form adhesions between the chest wall and pleural cavity. So basically there are a lot of sclerosing agents like tetracycline, minocycline, doxycycline, talc, erythromycin. So basically this is about sclerosing agents. So now I would be talking about surgical treatment indications. Surgical treatment indications when there is bilateral pneumothorax, recurrent pneumothorax, hydropneumothorax, persistent leakage of the air, tension pneumothorax, fail to drain, thickened pleura making the lung unable to re-expand, multiple bleps and bullae. So basically this is about indications of surgical treatment pleurodesis. Now main procedure is open thoracotomy and pleurectomy. So open thoracotomy में incision देके thorax को we open the thorax for visualization. So basically this is open thoracotomy, and pleurectomy means we remove the pleura. So basically this is about surgical treatment pleurodesis. So this is about treatment of pneumothorax. Thank you.